Good afternoon, everybody. Thank you for joining us. This is an offering through our Healthy and Resilient Workforce webinar series. I'm very excited for this topic today. My MPH focused around communication, so I'm very excited to get some updates from that. It will be presented by Holly Sheets. She is an associate professor at the Department of Communications, Media and Theater at Mississippi State University and director of the Message Laboratory. That's a communication research laboratory at the Mississippi State University Social Science Research Center. She holds a master's in public health degree from the University of Alabama at Birmingham and a PhD in communication from the Ensberg School of Communications at the University of Pennsylvania. As an applied communication researcher, Dr. Sheets' primary research areas of interest are health and science communications, and she specializes in the message effects research and survey-based experimentation. Thank you so much for being here today, and I'll hand it over to you.
Oh, thank you so much, Lydia, for all of your work in coordinating this. And also a shout out to Katie Buys for thinking of me and inviting me to participate in this seminar series. As Lydia said, my name is Holly Seitz. I'm here coming to you live from Starkville today at Mississippi State University. And I wanted you to know a little bit about my story because it certainly has informed my perspective on both public health and health communication. I started my academic journey here at Mississippi State as a communication undergraduate, but got involved in some undergrad research related to health in Mississippi that became a really formative part of my professional journey. And from here, I went to UAB and got my MPH. But after that, I felt the draw to public health. And I really wanted to practice. And so I started my career at the Centers for Disease Control and Prevention many years ago, doing health communication work, specifically in social media. And while I was there, I found that I really wanted to be able to do research in this area of health communication. And that's what ultimately led me back to grad school. And then I'm so grateful to have been able to come back to Mississippi to serve the people of the state here as a professor, where I get to spend time both teaching and researching primarily in the area of health communication. Today's topic was inspired through some conversations with both Katie and Lydia, thinking about what might be useful for you. And I realized as we come to the end of 2025, I want to acknowledge that for some people, this has been a very challenging year, and specifically within public health, and it may have been a very difficult year for you as well. And so we were thinking about the types of tools that might be helpful for you as you address the challenges that we're currently facing in public health. And I just want to say out of the gate that my appreciation for people like you who are working in the area of public health is tremendous. I just value your work so much. I deeply appreciate all that you're doing to secure the health and safety of people in Mississippi and beyond. So please know that you have my utmost gratitude, and I have so much gratitude and respect for everybody working in the field of public health. And my goal today is to provide some practical evidence-based strategies for crafting messages that will promote healthy behavior. That's at the heart of everything I do. And I have, kind of my own perceptions about the particular challenges that we're facing in public health right now, but I'm actually really curious to start out today by hearing from some of you. Before I do that, now that we've got a good crew here, I want to share some resources and the list of sources that I'll be referring to in my talk today. So there's a Word document coming through. Had a lot of fun compiling that list of sources, all of the sources that have informed my talk, and I hope that some of them will be useful for you. But we're going to start out today by hearing from you in the chat. And specifically, I want you to tell me, in your view, what are some of the biggest challenges facing public health right now? So please open up your chat, download that list of sources, and also share with me some of the challenges that you feel we're facing in public health right now.
I was still typing to the waiting room. Sorry. I'll get back in this
Right
room.
on. And also, if you have any trouble with that list of sources, please let me know and we can resend it throughout. Mhm. Thank you for that. So right now, funding is being mentioned as an issue. Personally, I've lost a couple of grants this year, projects that I worked on for many years that have been terminated because of loss of funding. And then you both touched on this feeling of being worn out, the burnout. Is so real, and so keeping the motivation going is difficult. Okay. So there's also a mention here that feeling that public health is under threat. And I've been feeling that as well. And we'll talk about some of the particular challenges that are threatening public health right now. Um, but also this idea that COVID has amplified the importance of the field. There's often this idea that I believe goes back to my training in public health that when public health is effective, it becomes invisible. And it's not until there's a crisis or an emergency or some sort of failure in the system that the importance of public health really comes to the forefront. I'm seeing that too. Thank you all so much for chiming in the chat and for sharing those ideas. And I want to turn now to some of the challenges that I've noticed that have real implications for me as a health communicator. So these are challenges facing public health that I feel we might be able to at least partially address through health communication. I'm going to share some literature from communication science, from psychology, even from political science that are related to these challenges. And then I also want to make sure that you've got some practical takeaways. So I'm going to be sharing some practical strategies that you can hopefully apply immediately in your day-to-day lives and in your professional work. Oh, and thank you too for these responses that continue to come in about the roles and positions that are eliminated absolutely as funding for public health roles gets cut. Thank you. So I'm going to talk today about three separate challenges. I'm going to talk about polarization. I'm going to talk about diminished credibility. And then I'm also going to talk about misinformation. And the first challenge that I want to discuss is this idea of polarization. I found a really great article that helps to define some of the terms that we can think about when we think about polarization, because I think about talking about political polarization. But this particular author divides polarization into both ideological polarization and affective polarization. So the ideological polarization is this divergence of political attitudes away from the center and toward the ideological extremes. So extremely conservative to extremely liberal. But then affective polarization is more about the state in which partisans come to love their partisan in group and loathe the out group, or both. And they point out that this intense polarization, the pushing apart of people to opposite ends of the spectrum, to those ideological extremes, or loving in groups and hating out groups, can actually have extreme effects on public health. So it can make legislation that affects public health more difficult because it's reducing the ability of legislators to make compromises. Or at the individual level, it can make it difficult for people to accept information that's not consistent with their ideological beliefs. And also with this idea of in groups and out groups can actually increase isolation, which we know can have effects on health. So I want to highlight just a few of the ways in which we're seeing polarization come out. And then in the second half of my talk, we'll move towards solutions. So just as a little bit of history in the history of polarization, earlier, just in the mid 90s to late 90s, we saw more cooperation in Congress. So there was bipartisan support for Medicare in 1965. There was bipartisan support for the Children's Health Insurance Program, or CHIP, in 1997. But as we got into the 2000s, we saw increasing polarization that affected health related legislation. So in 2010, not a single Republican in the House or Senate voted for the Affordable Care Act. In 2017, not a single Democrat in Congress voted for the Republican legislation to repeal and replace the Affordable Care Act. And so we're seeing increasing polarization in Congress. We're also seeing these differences among individuals. So moving from legislators to the individual, this is data from the Pew Research Center. And if you're not already using Pew data, I really love it because they are a nonpartisan, nonprofit research center, and their polling methods are highly scientific. And so I really love seeing their polling data, their survey data. So we see in this work from 2025, so this is earlier this year, they actually surveyed both Democrat and Democratic leaning and Republican leaning participants in the US, and asked them about whether each of these things was important for federal government to do. And we're seeing some differences here between people with different political affiliations. So Republican leaning felt it was less important for the federal government to track the spread of contagious diseases around the country, which is a key public health function. Or to study health issues that affect women and girls, again, very important for public health, or to develop programs to place doctors and nurses in rural areas. So we're seeing these divisions about the role of federal government in doing these public health functions. So as you can imagine, all of these things are going to have implications for public health. The second challenge I want to highlight. Oh, actually, before I move on, I forgot, I have this in here. It does show that we're not always far apart when it comes to looking at different parties. So there is hope that we might be able to capitalize on some shared goals and values. This was additional data from Pew on how Republicans and Democrats compare on major health issues, thinking about health issues that are a major problem for the country. And you see here, there actually is a good amount of agreement. The places where the two groups diverged was when we got to things like loneliness, bird flu, and measles. So of course, those things, there are certainly implications there for informing our work related to maybe measles vaccination or efforts to prevent the spread of bird flu. But there are some things on which the two groups agree. So I did want to point that out. All right. My second challenge, a key challenge that I see, is diminished credibility of public health agencies, people working in public health. That's certainly a challenge that we're working to counter. And this is some data from the data were actually reported in 2024, but kind of reflecting back. So in April of 2020, those early days of COVID, 87% of Americans had confidence in scientists to act in the public's best interest. But by fall of 2023, the figure had dropped to 73%. And that difference, connecting the two challenges from the extreme polarization to credibility, that drop was disproportionately driven by a drop in confidence among Republicans. But certainly that diminished credibility of scientists is going to be harmful to public health. There's also this partisan divide that was reflected in diverging views about the CDC. So it had a 78% favorable rating among Democrats in the summer of 2024, but only a 33% approval rating among Republicans. So again, there is, and that number was certainly affected by COVID. So COVID led to some drops in credibility of these major public health agencies, and we're also seeing a partisan divide there as well. this is where we get into actually seeing how that trust has declined. This is data from 2023 and then showing the decline between 2023 and 2025. So it wasn't just around the time of COVID, it's actually continued to decline since then, which is concerning. So this is actually data from KFF. So in addition to the data that Pew reports, KFF has also been tracking health information trust. And what they found was that when they surveyed people about their trust in their doctor, the CDC, state and local public health officials, and the FDA, they're seeing these consistent declines from 2023 to 2025. And they're seeing, on average here, lower trust among Republicans than among Democrats. I do want to point out some hopeful data that, as you can see, the numbers for people who trust their doctors is actually still quite high. And so that trust in the individual's physician, I think, gives us some hope and potentially even areas that we can leverage in our health communication. And I'll talk more about that later. The final challenge that I want to highlight and that I'll dive into later in the second part of my talk is the issue of misinformation. And I want to include disinformation here as well. So misinformation is false or inaccurate information. Disinformation is false information that's deliberately meant to mislead. And many sources will talk about how this has affected our ability to improve public health. Here you'll see that, and I'll go into more detail. So this was really interesting data from Pew about the role of misinformation in the COVID, the whole COVID event, thinking about both the virus itself and the vaccine and the response to it. And 57% of the US adults that they surveyed said that false and misleading information about the coronavirus and vaccine contributed to the problems that the country has faced in dealing with the outbreak itself. So these are people who are saying that all of that false and misleading information that was in the information environment was actually affecting the response, either through affecting, individuals' behaviors, their willingness to get vaccines, their willingness to do other behaviors like using masks. And so they felt that misinformation was contributing to the problems with the actual response. And it goes far beyond the COVID response. The World Health Organization has been investigating and dealing with health misinformation specifically related to vaccines for many years. Probably 5 to 7 years ago, they introduced vaccine hesitancy as one of the top concerns to public health worldwide. And we know that misinformation, the spread of misinformation, contributes to vaccine hesitancy. And so this is just a little message from the director of the Department of Immunization, Vaccines, and Biologicals at the World Health Organization, who says that the fight against misinformation goes to the heart of trust in public health. And so it's having effects on trust, and it's also having direct effects on behavior. All right, so what can we do about it? This is to me, the important part, because I have a feeling you were quite aware of some of these challenges, probably many of these challenges. And so I want to now get into thinking about what we can do to actually address these challenges. The CDC defines health communication as the study and use of communication strategies to inform and influence choices that people make about their health. And as a health communicator, my goal is to craft messages. So I think often about messages for specific audiences to achieve a specific goal. So in my mind, I'm always thinking about messages and audiences and goals. And that goal usually involves shaping behaviors that will lead to a healthier population. So with that in mind, just so that you kind of know what's shaping my view on the world. I want to share lessons that we can draw from the scientific literature as we address some of these current challenges that we're facing in public health with health communication. As we try to address this idea of polarization, I wanted to introduce you to a model that was created by Young and Blakely in response to the COVID pandemic. And they have laid out a model, which if you go to the source, the article itself should be open access to you. And they actually have created a beautiful visual that shows the ideological health spiral model. But I'll just outline some of the key points from that model for you. So they say that there are identity-driven motivations that we have, motivations that are driven by different things like our political ideology factors into that, and other cultural factors and other background factors as well. But these motivations lead to two different things that can then have effects on our health. So they lead to interpersonal discussions, usually with people who are somewhat like-minded to us. And they also lead to media selection behaviors. So we will select media that conform to our identity. And then those communication behaviors create what they call communication discrepancies. Those communication discrepancies are differences in the type of information, the sources of information to which we're exposed. And so my individual behaviors lead to different access to information. And then once those communication discrepancies have been developed, that information we're exposed to then shapes our attitudes, our social norms, and our self-efficacy related to certain health behaviors. These are predictors of health behavior that are all outlined in the reasoned action approach. If you're familiar with the theory of reasoned action or the theory of planned behavior, these precursors of behavior will be really familiar to you. And then the beliefs that are shaped by the information we're exposed to reinforce these identity-driven motivations that lead to the communication behaviors. And so the cycle just continues to reinforce itself. And if it's not interrupted in some way, then people's ideas are just being reinforced over and over, but one person may be getting very different information from another person, and that information may be shaping their behaviors in a way that doesn't promote health. And so the solution that they propose is creating some sort of communication intervention to break the dysfunctional spiral. That might mean sort of inserting a different interpersonal discussion. So maybe we introduce someone else who's talking to them about certain health topics and health behaviors. And so widening the information that they get through interpersonal discussion. Maybe it's an intervention at the media selection point where we're introducing different media for them to consume. Or maybe there are other interventions that would shape attitudes, norms, and self-efficacy in addition to that health information they're getting through the interpersonal discussions and media selection behaviors. So those are ideas from Young and Blakely that I thought it's an interesting way of conceptualizing what might be happening within this realm of polarization, where if people are selecting very polarized media sources, certain ideas are being confirmed there, whereas people who are making different choices based on their ideological background might be getting very different information. Additionally, I wanted to share a very interesting idea of creating messages that are designed to tap into someone's moral values. And this builds on Jonathan Haidt's moral foundations theory. If you've ever read his book on the righteous, I think it's The Righteous Mind. I'm going to find my actual title here. But The Righteous Mind. So Haidt actually has done some work to outline that um, we all have a moral foundation that is it's a foundation in which we kind of have dominant moral values that come to the forefront for us and shape our decisions. And he has identified sort of 6 themes of moral values. And those moral values that he's identified are care, which is sort of compassion for those who are vulnerable. Another is fairness, this idea that people should be treated fairly. Loyalty, which is encapsulated by the idea of personal trust and group identity. Authority, which is the competitive advantage of organized groups. Sanctity, which is defined as the idea that some things are sacred and pure. And then liberty, free choices and action. So people who value free choices and action would have liberty as a high moral value for them. And I was actually curious if you would be willing to share in the chat, and you don't have to, but are there any values in this list that you connect most strongly to? And after you tell me, I will be able to tell you some of the ones that seem to pop out for people within public health typically. So which of these values do you really identify with or connect to most strongly? Amazing. Y'all would not be surprised to learn that in Martin's research, and this research is actually from her dissertation, she found that people working in public health often prioritize care and fairness as their top moral values. And her work went on to see if we could design messages that are designed to really tap into the values that people hold. So Haidt's work has shown that typically, on average, and again, this is not everyone, but on average, people who tend toward the liberal end of the political spectrum tend to hold care and fairness as their top moral values. People who are on the conservative end actually hold all of these values. And so messages that only tap into a couple of the values that may not be shared by everyone may not be as effective as messages that align with the values that people hold. So it's the idea of tailoring messages is kind of a matching hypothesis that we should match the message to the values that people hold. So Martin actually tried this and tested it empirically with some local officials. So she had a public health group, and then she had a local official group that was separate from the public health group. And she tried to create an anti-vaping message that used only appeals to care and fairness, and compared that to a message that used only appeals to loyalty, authority, and sanctity. And she found that the message that appealed to care and fairness was actually most successful. And I think because those values were shared by both groups. If you have a message that taps into all of them, then that's more likely to be more successful. So she did not include a message that had appeals to the whole set in one message, but I think that Haidt's work would suggest that that would be the ideal. But I put this in here so that we can at least think about tapping into the values of our audience and crafting messages that will connect to that. If care and fairness are top of mind for us, which the data shows that they will be for people who are working in public health, because that's a lot of what drives our work, we need to broaden our appeals potentially to include others as well. But you can keep the care and fairness pieces in there for sure. Additional strategies to address polarization that were suggested by Van Bavel are one, to work to increase trust in public health agencies. And we'll talk in the next section specifically about trust and credibility. So that's easier said than done. This other suggestion from him is also easier said than done. So ideally, leaders across the political spectrum and trusted public health or public officials will communicate health information in a coordinated fashion. If we're able to do that, that is a strategy to address polarization, but that can also be quite difficult. If you can pull it off, that will help to address it. That can be difficult to coordinate. But then the third strategy, I think, is very doable. And this is using trusted in-group leaders to deliver health information. I think despite the fact that if groups are polarized, if we can find someone within those polarized groups who is a trusted leader and we can recruit them to our team and have them help us deliver health information, that is a strategy that can help us address this polarization. All right, let's move into credibility. I'm curious to have you think about someone that you trust to give you health information. So first, think of someone that you personally trust, and you won't need to disclose who that is, but bring that person to mind. Think about who you trust. And now what I want you to share in the chat is, why do you trust that person? Why do you trust that person? It can be any reason, but share why you trust that person to give you health information. Nice. So I'm seeing responses around the fact that the person has been to school in a particular field. They have knowledge, they have experience. Seeing other mentions of knowledge, expertise, experience, knowledge, empathy, reliability based on previous experience. Y'all absolutely are hitting the nail on the head here. So when we think about credibility, I want to give you just a little background on credibility. As you know, credibility is a major driver of the attitudes that people hold and behavior, including health behavior. And this is especially true for those who may not carefully process the content of a message. So I want to introduce y'all to one of my favorite models of communication, the elaboration likelihood model of persuasion. It's something that I've been fascinated with for years, and it's informed a lot of my work. But the elaboration likelihood model of persuasion suggests that there are two routes to persuading someone, the central route and the peripheral route. If someone has the ability to pay attention to and process our message, and they're motivated to pay attention to and process our message, then we have a good chance of persuading them through the central route of persuasion. They will be probably a little harder to convince, but if we're able to persuade them, they're paying attention, they're processing our messages carefully. If we persuade them through that route, then they're more likely to stay persuaded. But not everyone is able to carefully process our message, or they may not be motivated to process the message that we're sharing. So if they're not able to understand what we're saying, or they don't want to listen to us, then we're working in the other route of persuasion, which is called the peripheral route. In both of these routes, credibility is a factor. If you're trying to persuade someone through the central route and they're paying careful attention to our arguments, then the credibility of the source is a piece of that argument. And that's important information that they'll use to decide whether they're going to be persuaded or not. If we're persuading someone, they're not really paying attention, or they're not carefully processing our message, they're not able to, Credibility is still an important factor because people processing through the peripheral route are more likely to use mental shortcuts to make their decision about whether they're persuaded. So their credibility serves as a heuristic cue, and they'll go, well, I didn't have time to read it all, but I trust that person. And so, yeah, I'll take what they said. And so, in both of these ways, credibility is a key factor that might determine whether somebody's persuaded and whether it will change their attitude or shape their behavior. And credibility breaks down into two components: expertise and trustworthiness. I've always summarized these as expertise is, do they know the truth? And trustworthiness is, will they tell the truth? That's a bit of an oversimplification, but it helps me remember it. So, expertise, these are the perceptions that we have about someone's education, their credentials, their experience. So, these are all things that they have that tell us that they have the capability of knowing the best information that is credible. Trustworthiness really is more about our perceptions about their character. So, will they actually tell the truth? And these two things combine to create credibility. Those two things are also things that we could shape with communication. We can share information about background and experience that will help to shape people's understanding of someone's expertise. And there are also things that we can do to increase trustworthiness, and we'll talk about those. But y'all were absolutely right on with the things that play into your own ideas about how you can trust someone or how credible they are. There was a great experiment that I wanted to share with you where they exposed people to some online health information and they varied the source of this health information. And in the end, participants perceived that the authors of health information who had medical credentials compared to non medical credentials had higher levels of expertise, and they judged their information to be more credible. They also found, I thought this was really useful, they compared a version with technical language to a version that they called everyday language. And they found that using technical language actually negatively affected perceptions of the author's integrity and perceptions of the credibility of their health information. So there are definitely some takeaways from this for us. So some strategies to enhance credibility. I want to kind of go to that first source I shared with you. One thing that can increase credibility is to increase the ability of the audience to identify with the spokesperson. And we can do this by having the spokesperson show compassion and understanding. And if an audience member is able to really connect with that spokesperson, that identification through things like perceived similarity can really help to increase their trustworthiness. Also, increasing organizational transparency and providing honest, complete, and accurate information where we can will help to enhance the credibility of an organization. And then finally, enlisting the help of additional credible sources to help share your information can be useful. So, credible sources like physicians, we see that doctors are a trusted source of information, and that could be a really useful strategy. In thinking about that second study that I shared with you, if someone has medical credentials and they're your spokesperson, it's helpful to disclose that based on the data that they found. And also, I think for all of us, as we're communicating about health topics, if we can use non-technical language, that's going to help our audience in many ways. So it probably will help with comprehension, but it also will help to enhance credibility. And then finally, leaders, scientists, and government officials should also emphasize the unknowns and the uncertainties, along with expectations for when more will be known. This really aligns with some of the crisis and emergency risk communication principles that I've been taught along the way, sharing what we know and also what we don't know, but letting people know when we expect to have additional information. And then if we can find trusted members within various communities who can disseminate important health information, that's going to enhance credibility. And you'll see that some of these strategies show up across the different challenges that I've highlighted. You'll see themes again and again, and finding trusted messengers is one of those themes that you'll see over and over again. All right, so we're moving into now the third challenge that I've identified, which is misinformation. So we're going to poll on the first of these questions first. I want to know, have you ever heard that the Great Wall of China can be seen from space with the naked eye? Have you ever come across that piece of information? And you can tell me in the chat. Okay, good. Rita, I'm glad that you've never heard that. It's not true, but some of you have, right? Yes. So this is not true, and it has actually been explained in multiple articles that without magnification, one cannot see the Great Wall of China from space because it's only actually about 20 feet wide, and in many places the stones blend in with the landscape. So that's not true. What about this next one? Have you heard that we only use 10% of our brain? Okay, so some people have heard that, others have not. That also is not true. So imaging of the brain shows us that we are using all parts of our brain. They're maybe not all firing at the same time, but through time, we are using all parts of the brain. They're all important. But somehow this idea got perpetuated. I share these to share with you that even if information is false, it gets stuck in our head. And so it can be really difficult to debunk and unstick this misinformation. There are many people who continue to walk around with incorrect perceptions because misinformation is so sticky. And over time, sometimes we can hear a fact, hear that it's false, and then over time we forget this idea that it's false, and we just remember that one time that we heard it. There's even an idea that misinformation, even after it's corrected, can continue to influence attitudes. That's an idea called the continued influence effect. Even after it's corrected, misinformation can continue to have a harmful effect on people's attitudes and behaviors. And so I want to take you through some of the strategies that we know of to address misinformation, specifically related to health. So health misinformation has some really dangerous effects on health behaviors, and we want to do our best to correct this misinformation. So I've pulled together lots of strategies. I also want to, again, remind you about the file, and I'm going to post this again in the chat. If you have not already downloaded this list of sources and other resources, please do, because the misinformation section in particular has some great links to resources that have been pulled together, some specifically related to vaccines, if that's a health topic of interest to you. All right, so let's dive in to some of these big recommendations. So I have linked there for you a systematic review of 29 communication interventions that were designed to counter vaccine misinformation in particular. And so as they reviewed these 29 communication interventions, they found that the interventions grouped together in different types of interventions. And in looking at the evidence from the interventions, they found that some interventions were more effective than others. The strategies that were not effective were things like scare tactics. This includes showing disease images. And so the implication here is that any communication intervention to address vaccine misinformation should not include scare tactics. Those are not only ineffective, but some of them had backfire effects where they made people even more resistant to correct information. And also ineffective was communicating with certainty about a topic like vaccines. Obviously, vaccine science is constantly changing and being updated, and there are some areas of uncertainty. And so the evidence here suggests that we should acknowledge that uncertainty and that to not do so could actually have harmful effects. Some interventions that were promising were communicating the weight of evidence. And so helping to show the evidence and the scientific consensus around vaccines, that was helpful in lessening belief in vaccine misinformation. I actually found that the 3 studies that used humor and tested humor against other types of messages were effective. I want to express a little bit of caution there and maybe dive into those specific studies to see how they used humor, because I think that humor might not always be effective, but in these cases it was. And then a strategy that you will see across multiple lists of recommendations is this idea of pre-bunking or inoculation by either incorporating warnings that someone might encounter misinformation before they actually are introduced to it, or this idea of providing a corrective message prior to the misinformation exposure. This is an idea that by warning someone that they might be exposed to misinformation later, we can actually strengthen their defenses against it. So the inoculation idea within health communication is related to the inoculation idea of vaccines, where if we expose someone to an argument and help them understand why it's false, then when they come across that particular argument in the information environment, they'll be better prepared to fight it off. And that's an idea you'll see across a lot of recommendations. Another list of recommendations that comes from Lewandowski and this is all informed by cognitive psychological science. His list of strategies is to first fight that continued influence effect I was telling you about, this idea that even after it's debunked, misinformation continues to influence us by providing an alternative explanation. So the idea here is that when we debunk an idea, we leave a gap in understanding. And so to fill that gap, we need to provide an alternative explanation of what's actually happening. And then people need to hear correct information repeatedly because we tend to forget. And so we need to continue to share the correct information without reinforcing the myth. So usually when I talk to people about correcting misinformation, if someone's already been exposed, we want to repeat what's true without repeating and reinforcing the myth. The more people hear a myth, even if they're immediately told it's false, the more someone hears something, the more they are likely to believe it because of the repetition. So we want to try to avoid reinforcing the myth and instead say what's true. We want to fight the familiarity backfire effect, this idea that, oh, I've heard that a lot, it must be true, by reinforcing correct facts. So that's what I was saying before. And then there's also this idea that simple myths are very attractive. They're very, very cognitively appealing. And so we need to fight that attractiveness by also making sure our rebuttals are simple and brief. So the more complex a rebuttal is, the harder it will be to believe and understand and remember. So if we can craft a simple, brief rebuttal, that will be more effective. And we can also help foster some healthy skepticism about the information source as a way to help someone start to kind of unravel that health misinformation. And then the fourth point I think is very important. Lewandowski and colleagues said, if the evidence that we're providing to counter health misinformation threatens someone's worldview, their perspective on the world, that can be very threatening to them as a person. And there's a temptation to put up walls to protect one's understanding of the world. And so ways that we can help to prevent this type of reactance and to prevent sort of that shutting out alternative information is to start by affirming someone's personal values. So we can say something like, I know you're a person who cares about others, or some other value that we've noticed in them. And we can help frame the evidence in a way that is actually consistent with their values. So if we can try to connect to someone's worldview, help frame information in a way that's consistent with what they value, then that might be more effective. I want to insert something here about reactance because I didn't mention it earlier. But a lot of times, if something that we're recommending goes against what someone has always thought or what they want to do, they can experience psychological reactance where they feel like their freedom is being threatened and they want to instead reassert their freedom by rejecting the behavioral suggestion that we're making. And I've seen this a lot within the realm of health communication, even in conversations with my own family and friends, usually related to things like vaccines. And so, in cases like that, where you want to help to diminish reactance, I found that language that helps them reestablish their freedom can be really useful. So things like, I want to share this information. The decision is up to you, or the choice is yours. What you do with this is totally up to you. I just want to make sure that you have good information. And so language like that, emphasizing their freedom of choice, can be really useful in helping to cope with psychological reactance. All right. And then finally, the American Psychological Association has put together a great consensus statement on fighting health misinformation. A lot of their suggestions are similar to Lewandowski's, but I wanted to reiterate them here because there are some differences. So one of their key recommendations is to, again, avoid repeating misinformation without including a correction. We want to make sure that that correction is dominant and that we're always emphasizing the correct information. We also want to, again, you'll see the trusted sources pop up here. We want to leverage those trusted sources to counter misinformation and provide accurate health information. I want to have a brief aside here to note that who is trusted will vary from audience to audience. And so often, as a health communicator, my work is all about audience research and thinking about who will be trusted within that particular audience segment for whom I've decided to craft a message. And so I want to encourage you to do the same. Choose an audience, identify who their trusted messengers are, and then see if you can recruit them to help you provide accurate health information. The third recommendation from APA is to debunk misinformation often and repeatedly using the evidence-based methods that they outline. So we want to make sure it comes from a trusted source. We want to provide details about why the claim is false and emphasize what's true. And then, if possible, the most effective counter to misinformation that we found so far is this idea of pre-bunking misinformation before someone's actually exposed to it. So if we can inoculate susceptible audiences by building skills, building resilience from an early age, and helping them become, critical of message sources and critical thinkers who will examine a message and try to find out and confirm if it's true or false, that can be a very effective strategy for addressing misinformation. All right. As we start to wrap up today, I just wanted to share that in addition to the evidence-based strategies that I've shared with you, I wanted to note that on a more personal note, I have found success through staying true to my personal values. And so I wanted to share with you that some of the values that drive my work are curiosity and compassion. And So I found that when we're really curious about the lives and the values and the beliefs that are driving someone else's behavior, it can make us better scientists and better practitioners. And so curiosity is usually at the core of my work. And my focus on compassion, this idea of alleviating suffering for other people, reminds me to always keep human health and well being at the center of my work. And so on those tough days, I remember my focus on curiosity and compassion. And those are things that really drive my work and inspire me. To all of you who are facing the exhaustion and the burnout, I just want to let you know that you're seen and you're cared about. And there's someone out here who truly appreciates the work that you do. I have really enjoyed guiding y'all through how to address some of the three big challenges I've seen that are facing public health using health communication. And at this point, I will open it up to questions for y'all. I'm going to go ahead and stop sharing at this point.
Wow, thank you for that. I appreciate all the research. You put a lot of effort into this presentation today. Thank you so much for that. And my background is a dietitian, and so I practice somewhat clinically that way, but then also in a community and public health way. And so much of what, and I guess my mind with being on the new year coming up and everybody's New Year's resolutions and things like that. And um, in the field of dietetics, nutrition's kind of a low hanging fruit. Everybody can feel like they're an expert in nutrition, and so often dietitians have to. I feel like we need to do a better job of pre-bunking. All the information out there on social media and the misinformation that's out there. So I really appreciate that concept of pre-bunking for dietetics, but also in public health. I mean, it just everywhere. It seems like there's a lot of misinformation. So thank you
You're
for
welcome,
that
Lydia.
concept.
It's a great idea when your work is seasonal in that way, and you know that these messages are coming. You can actually advise clients like as you're coming into the new year, you're going to hear a focus on this. You're going to hear a focus on this. When you do, I want you to remember this, and that's where you get to insert the message that you want them to know. That's
Yeah.
such a great application. I love that.
Thank you for that.
What other
And
questions or comments?
well, Rita is our section chair of the health administration section, and they had an awesome webinar on Monday of this week, and just kind of talking about leadership throughout this difficult year. And she talked a lot about communication and how you can't over communicate. We are hit with so much information right now, and she just helped us remember use all your channels that you have, and you have to communicate, like put the message out there, and you will still have people that say, I don't know. I didn't hear about that. So I appreciated you too, just in encouraging us to use the different channels that are out there. And I don't know, Rita, I don't mean to take over for the section you had, but that was definitely a message from Monday that stuck with me. I don't mean to keep talking. I'm so sorry. Um, and it's fun that you and Caroline went to school together. I think that's really neat.
Oh, I know. I was just mesmerized. I was soaking it all up. I mean, it was fabulous, and not because I'm completely and totally biased, but it was wonderful. So, I hope this was recorded or that it'll be posted so that I can watch it. So
I agree. I need to go back and listen again
I do, because it was such good information. It was like being in school again. I was just like soaking it all in, and I love it.
Thank you, Caroline. I do realize it was quite dense. So hopefully
But I
you
loved
were
it.
mentally prepared to just have a lot of text thrown at you. My apologies. Usually I try to be a little more engaging and a little lighter on the content, but this one, there was just so much I wanted to share, and I had a really tough time carving it down.
I loved it. It's total academia, and I needed a good dose of it, so I loved it.
I
So
think it was engaging enough. At least getting us to answer those questions briefly was good to think and connect us. And thank you for the presentation. It was actually Lydia that told me about it. I think I registered yesterday or this morning, something like that.
Yeah.
yeah.
I was like, yeah, something again on communication. I really agree. You really can never communicate enough because you're asking about seeing the the Chinese wall from, I've never heard that.
No, that's a good thing, Rita. I'm sorry, now I've introduced that misinformation into your brain and it will never fully be debunked. And my apologies. I hoped that that one was harmless enough that it
No,
wouldn't.
I mean now I know. And then 10% of the brain, I've always thought that because I've heard that all the time. So now I know it's not true.
That's right.
Yeah.
And now you can know that you're going to come in contact with someone one day who's going to say, "Hey, did you know you can see the Great Wall of China from space?" And you can say, "Actually, no, that's false information. I've been pre-bunked, and now I know that it's only 20 feet wide and cannot be seen from space with the naked eye."
Oh. Sometimes I worry that I only use 10% of my brain, but that's not because it's not available to me. It's just because it's a user malfunction, not a access or availability
But now
malfunction.
you know you don't.
You know,
Oh, well, Lydia, I see
middle
that
age
you're
for you.
right at 1 o'clock. So I guess we have
Yes.
to wrap up for those who have to move to other meetings. I want to thank you
Yes.
all so much for spending your midday with me. It's an honor to join you and to reconnect with friends and to make new friends. So thank you again for
Okay.
having me.